Spinal stenosis, as the name implies, is a narrowing. That is a Latin term that implies a narrowing condition of the spinal canal. The reason that that is important is that that narrowing can ultimately put pressure on the nerves that allow us to use our extremities. In the case of the cervical spine, the arms, and in the case of the lumbar spine, the legs. The stenosis can be a range of severity. It can range from mild to more severe. In mild cases, conservative treatments are often very helpful. In more severe cases, where there's manifestations of things like weakness and numbness, it is potentially a problem where surgery is really the right answer. It's not to say that conservative treatments can't be helpful, but many times severe stenosis really requires a surgical intervention. Particularly in the neck or the cervical spine, things can be dangerous in terms of prolonged pressure on the spinal cord, resulting in damage to the spinal cord, resulting in potentially a permanent neurologic deficit. In terms of treatment for spinal stenosis, we have essentially two main arrows in our quiver in terms of treatment. One is to decompress the nerves. And in the case of the lumbar spine, that is often in terms of that area, an incision on the low back that results in what's called a laminectomy. To do a laminectomy, we perform an operation where we remove a portion of the lamina back here. And in cases where we've defined the particular area of problem, we will remove this fin potentially and part of the lamina as well as part of the joints to open up the nerve canals and nerve pathways to relieve the pressure on those nerves, which then relieves hopefully the pain and restores function. In the cervical spine, we often will do that operation through the front of the neck, and there are some nuances as to why we do that, but essentially in the low back, we can retract a nerve, but in the cervical spine, the spinal cord does not allow for retraction or significant retraction of the spinal cord in order to decompress the nerves, and therefore we sometimes have to make an incision on the front of the neck and remove the disc in between the bones to actually open the pathways for the spinal cord and nerves. That is, in both cases, potentially something that can be very helpful in terms of relieving pain and restoring function. Most of the time, patients are worried about the potential complications of surgery, and there's always potential complication for surgery regardless of what type of surgery you're doing. It doesn't just happen in spine surgeries, it can happen in any surgery, and those risks are relatively low, but you need to talk to your specific surgeon about those risks and ask questions and get a better understanding of your risks, because there are risks certainly to doing surgery, but there are risks to not doing surgery as well. And some patients, unfortunately, wait too long and develop a problem that may be permanent based upon their particular pathoanatomy.